Dr. Jensen, who should get the COVID-19 vaccine?
I think the question for me is not who should get it as much as who should not get it. And for me, I would say I don't think kids should get it unless there's a compelling reason outside of what I've seen at this point in time. I don't think pregnant women should get it. I don't think that women that could get pregnant should get it. We don't know what this kind of mRNA vaccine could potentially mean for someone who's pregnant. We don't know exactly how long its effects could last. So if one gets the vaccine when they're not pregnant, but within 4 to 8 weeks thereafter becomes pregnant, is that an issue? And then lastly, anytime we're vaccinating children, we have to be extremely careful because children are oftentimes very much in the midst of having cellular division. They're growing, cells are dividing, mitosis is taking place. To vaccinate a child who's growing, particularly perhaps an adolescent who's growing rapidly, is dramatically different than vaccinating someone like me who is in his 60s and doesn't have nearly the kind of reliance on mitotic cellular activities. I think that the population under the age of 50 are going to potentially have the least amount to gain from getting this vaccine, especially when we see data coming from the FDA that indicates that we don't really have the kind of robust demonstration that the vaccine will stop COVID-19 mortality in its tracks, because we don't have that data. So to me, I think we have to look at the population that not only is vulnerable, but also data shows has the highest risk of being hospitalized and potentially subsequently succumb to this disease.